Hi, everyone. I'm Bonita, and I created this channel so those of us with chronic pain could share ideas and support so that we could live our best lives possible. If you don't know me and my backstory, I had a ruptured disc in my back, and a doctor gave me an epidural in which he punctured my spinal cord. It caused permanent nerve damage where the nerves clumped together, called adhesive arachnoiditis. It causes numbness, it causes spasms, involuntary movements, and cramping, as well as I have lower back pain that will seize up my back. I have difficulty walking. I have difficulty with my balance. And then I also have osteoarthritis. I have it in my hands, in my wrists, in my thumbs. And then I've had other injuries as well. And it's very difficult at times for me to walk. So I've been to 3 neurologists, 3 pain doctors, which the first one is the one that damaged my back on the very first epidural I had ever received. I've had 6 kids, and this was my first epidural, and he botched it, creating me with a lifelong pain situation, and it basically has made my life and the activities that I did before extremely difficult. Because of that, they have given me a diagnosis of fibromyalgia because you can basically touch me anywhere and I have nerve pain. But that is related directly to that spinal puncture. So I have been to multiple specialists. I've been to a nerve specialist, and everyone starts the conversation with arachnoiditis. You know, there's nothing we can do for that, right? And they've done all of the tests with the heat, the cold, the vibration, the pin pricks, and all of those started out where I had a little bit of feeling everywhere except my lower left leg. My lower left leg never woke up after the epidural. And then they have also done the nerve conduction study, which caused me enormous pain and an enormous flare afterwards. I will never have one of those again. But I feel like I've exhausted basically all of my means for any type of support. They told me I could just refer back to my regular physician, that they couldn't do any more for me, and that she could take over any meds that I was on. And the meds that I'm on are diclofenac 3 times a day, which is an anti-inflammatory. I'm on Tylenol arthritis 3 times a day, and I am also on amitriptyline 10 milligrams, which I take at bedtime, and tizanidine, which is a muscle relaxer because of the cramps that I was having. I use a pulsator type of massager. It's handheld. My husband uses that on my back a lot of times. I have severe sciatica pain. But rather than getting into more and more of my personal complaints, because I know you all have them as well, I just wanted to tell you what I'm dealing with so you know what type of channel this is, and you can help provide support and encouragement for those of us and yourself that are dealing with chronic pain. Because I feel like only we really understand what it's like to be dealing with this on a day-to-day basis and still try to be supportive for our families, still try to be active, still try to be involved in what our families do. And it's really tough. And this past year, I've had a really tough time. I try to get out and walk when I can. My distances have gotten shorter. And when I walk, I literally feel like my back is collapsing on itself. I feel like I'm not doing as well as I did last year at this time. And when my back feels like it's collapsing on itself, I have difficulty breathing because everything is just smashing together. Well, I saw this ad the other day from one of our local chiropractors, and I know a chiropractor cannot touch me. They cannot. I would have even more problems. But he has taken in a person with his same philosophies of lowering your medicine, getting people off of gabapentin, which is a horrible drug, and then also helping people regain some feeling in their neuropathy. And they are especially focused on peripheral neuropathy, and they don't believe in surgeries, which again, I fall in that category. No surgeries would help me. So they were offering this introductory offer where you could go in, they would assess you, they would do x-rays, they would do all those tests, the heat, the cold, the vibration, the pinprick, strength test. They do all of those things to see where you're at. And from the last time I went, which was about a year and a half ago, was my last appointment. I have gone downhill where I had feeling between 1 and 10 that would be like 3. A lot of it was now like 0 or 1. I've got decreased sensations on all of my lower extremities. And so they did a bunch of x-rays, including my hips, my knees, my back, my neck, and they actually confirmed what I said I was feeling. I felt like my back was collapsing on itself, and they said that was true, that it was collapsing on itself and it was starting to fuse. They also said that my good leg, that my right hip was rotating in and that my knee was collapsing. Well, my left leg is the worst. So my right leg is compensating for that. And my right leg, I don't have any knee pain, and I have both hips hurt sometimes. My back hurts. I just have random pains because of having nerve damage. So my pains are different every day, but I have pain every day. And the lady that was the practitioner told me that she felt she could work with this. They have some sort of thermal technology that they are using on people to try to help their neuropathy symptoms of the tingling, the burning, the electrical sensations, all of those things that I have, and I know many of you do as well. So again, like I said, this is a pain clinic that doesn't use needles, doesn't prescribe medicine, and doesn't suggest surgery. And how often do we go in and that's the first thing they say? I have stenosis of the spine, which means I have a narrowing of the spine. And both of the last pain doctors I went to immediately wanted to do a spinal stimulator. I don't have room in my spine for that. And I have heard so many horror stories because I've been an administrator for a nursing home. I've worked for the Department of Aging. I've heard so many people tell me how the temporary one goes in. Maybe it does well. Then they put in the permanent one and they have so much pain and that it has to come out. And those doctors are getting paid for the temporary one, taking it out, putting in the permanent one, and then taking it out. In fact, one of the ones I went to said he'd been doing this for 22 years. And I thought, well, he's made a really good living at that. But I know I'm not a candidate, and yet they both wanted to do that to me. It was not in my best interests. It was in their best interests. And that's why it's so important that we educate ourselves on all of this technology that they try to suggest, because many times it is not for our best interests. And I hate to say that, but the medical field is about making money in most of our cases. And many of us are in situations like I am, where any type of thing like that could actually make us worse and could actually make me wheelchair bound. So I'm not willing to risk them trying something that I already know is not recommended and not a good idea. In fact, the nerve specialist I saw said, no, that is not for your type of case. So educate yourself so that they don't talk you into some of these things. Sometimes we're so desperate for pain relief that we can be talked into some of these things that actually can make us worse. The doctor that injured my spine was very flippant. He didn't act like he did anything wrong. It took 5 days for him to even return his call to the hospital because I was having so many problems after the blood patch of the hole that he had punctured. And even then, he just told me, drink more caffeine, that should seal it up. He never followed up with me. He never checked after that to see if I was okay. I ended up in the emergency room with my loss of sight within the next week. So I just want to throw that out there that you really need to pay attention to your body and do your own research. I know sometimes things on the internet can scare us, but find someone that you trust, like these other neurologists that I saw and the nerve specialists that I saw. I trusted them, and they also confirmed with me that what I was thinking was correct, that I was not a candidate for any type of procedures and that those would make them worse. So this procedure is more of a thermal procedure. It is non-invasive, and I am going to go for a consultation this next week to get a full diagnosis of all of my x-rays and the treatment plan, and then I will decide from there if I want to move forward. Their deal was with vouchers. If they could not help you, they would not charge you for all of the x-rays, the consultation, the exam, nothing. So they say they think they can help me. Now, even if they can help me some and it's non-invasive, I'm willing to try that. So I will let you know what they say in my next video. I don't know if something like this is available where you are, but I'm really excited to have an option because I thought I had exhausted every option that there was. Thanks for listening today. I hope you have a great day, and I hope to talk to you soon. Let me know in the comments if you have ever heard of this, if this is something that would be of interest to you or helpful to you. I know there's so many of us out there with multiple diagnoses, and neuropathy is a very common one with a lot of our chronic pain.